Welcome to the Trailblazers. I'm Perry Rarick, your host. The purpose of this interview series is to share with you interesting discussions I have with trailblazing business leaders. My guests are innovative, thought provoking, they're experts in their field, and they're not afraid to challenge the status quo. My trailblazer guest today is Susan Stipa. She is the Chief Executive Officer at Phylloceuticals. They are a unique technology company that brings drug therapies to patients safer, faster, and more cost effectively, and they do it using plants. We're going to hear more about that from Susan. It's a very, very interesting technology. Susan is everything you'd expect from a trailblazer. Armed with a chemical engineering degree from the University of Virginia, she embarked on a career as a process engineer, and she has extensive experience in just about all facets of delivering therapies to patients, from the lab and manufacturing facility to commercial operations, both business development and marketing, and also public relations, and nearly 2 decades in executive positions with companies like Roche, Foster Wheeler Biokinetics, McDay, which is a strategic marketing company, CG Life, and now Phylloceuticals. And she's here today to talk about that and much more. Susan, welcome to the Trailblazers.
I'm delighted to be here, Perry. Looking forward to the conversation.
Well, this is going to be awesome. Thank you for joining me today, Susan. We've got a lot to talk about, and it's going to be very interesting. We're going to talk about your role at Phylloceuticals as their CEO. But before we do that, I want to hear, and I think it would be valuable to our audience to hear about your career journey. It is a trailblazing one from beginning to end. It is very fascinating, and I want to spend a little time on that. You became an engineer. You went into marketing and public relations. Now you're a CEO. I don't know if that's typical or not. It doesn't sound all that typical, but it sounds fascinating. And I know each role built on the other. But how were you led to engineering?
Well, my dad was a civil engineer, and so he was the one who would take me outside and show me the stars, and we'd look at rocks. And so I had a keen interest and an excellent sixth grade science teacher named Mr. Peck. So the idea that science was fun was sort of an early thing for me. So it sort of never occurred to me. I am actually a writer. I love to sew and paint and all of those things, but I sort of knew that I could always do those, but I couldn't teach myself the sciences. So, straight A student in high school in sciences, it's almost an automatic. But engineering was not my first choice, Perry. I went in as a chemistry student. And after one semester purely in the lab, I thought, you know what? I think dad was right. I'm going to try engineering. So I transferred over, and yeah, here we are.
It's amazing. It's fascinating to me and encouraging, inspiring that you mention a teacher. You know, I always think, teachers may not remember us, but we always remember those special teachers that inspired us. So thanks for mentioning that.
Oh yeah, he was up on the lab desks if he had to be. He just, and we still see him. The students still follow me, still alive and well, and he's getting a lot of thanks, through social media from his students. He was amazing.
Awesome. So you said you were a writer, kind of at your core. So how did you transition from this engineering world, a process engineering world, into marketing and then public relations?
Somehow you get the idea, or I did, that marketing is more creative, and I thought there has to be an intersection between those. And I guess in my early 20s, that was sort of, I recognize now, as a moment of pure intuition that these two could meet. And so from Roche, I took a job in marketing for a rheological instrumentation company that was willing to take a bet on someone who never had a marketing class. And I think the idea of being able to take a step back and see a product or a service and figure out how to present that to the world is sort of the basis of marketing strategy and even PR, how to how to figure out what is going to be appealing was really a creative process. But I always say scientists, mathematicians, we're doing the same thing in trying to figure out how to solve a problem. So the two aren't as left brain, right brain as I think a lot of folks would like you to believe. I always say scientists that I've met, engineers that I've met, are some of the most creative problem solvers in the world. So marketing just lets you, use a lot of color and word choice to express that, but the 2 are pretty closely aligned. So I immediately loved marketing. I love the idea of presenting our products to clients, and ended up hiring an ad agency in a job that I had that brought me here to Philadelphia. And this was a young guy, who was my account manager who later started his own business. And he just thought it was so cool that a chemical engineer was in marketing that when he started his business, he said, "Well, will you come with me and be my first client?" Later on, he became, I mean, he is still a dear mentor of mine. He was the one who said, "I am kind of done. I want to start my own agency. Would you come work for me?" So in my early 30s, I actually went to work for my first ad agency. We focused on science, not necessarily life sciences, but science in general. And he'll still tell the story of how he would just keep driving as I'm chatting away with the client scientists in our language. He later ended up selling me that business, which became McDay. So I think these mentors that we have can, really help navigate any career. But for me, it took someone who said, "Yep, I love this combination of creativity, writing," 'cause, I mean, all marketers are great writers. They're great, you have to conceive of the idea and then be able to convey it, whether in headline or longer form writing. Um, so yeah, it was all the mentors that we see along the way, and Bill in this case, who took me right into McDay.
Fascinating. I agree wholeheartedly with everything you said. It's just amazing. The combination of science and creativity is just a fascinating space to work in. Um, I'm gonna ask you this later on, but I don't wanna go past this too quickly. That took a lot of courage to jump from science to marketing. That first gap that you that you leaped across. What can you talk a little bit about that and how you felt comfortable with doing that?
Yeah, I've been asked this question a number of times. I again kind of go back to my parents who I really I must be missing the fear gene in some form or fashion. And I don't mean that facetiously. I was always given so much support to, those were the days when you were sent outside and you just created your own day and you could do whatever struck you. And I was a very, I think now is a pretty creative child. So I'm going to say some of this when I talk to people is takes a little bit more thought, and you have to jump over this fear barrier. I have a little less of that, but I still think the world takes you in directions that you could never anticipate. So today's current obsession, I think I've a child still in college and trying to figure out what am I going to be. And my message is always, don't worry so much. The path is not going to be what you think it's going to be anyway, and that should take a little pressure off. So I think it's some combination of personality, but also openness to knowing that the world will deliver a lot of challenges and a lot of opportunities, and just stay open, so that you can see the paths ahead of you and then, be brave enough to choose maybe one that wouldn't be what everybody else wants. Becoming an engineer in and of itself was probably chosen because I knew not a lot of other people were going to do it. So I always have that angle in my personality that wants to do things a little differently.
Yeah. That's awesome. You've got extensive experience in commercial, operations. I half or more of your career. How has that evolved, changed? What are some of the challenges that exist today that, how would you talk about that evolution of these commercial operations in this life sciences space?
Yeah, I mean, I think from a person, my personal point of view is I think there's a lot more talk about the types of people that can take on these roles and they can come from a wide variety. In fact, it's very helpful, I think, to have individuals in these roles who have a broad base. So they can be attorneys to start, they can be, they can be scientists, they can be a lot of other things. I think the role has evolved to be more honest about the fact that you don't need to be just an expert in reaching out, an extrovert, as it were. I call myself a learned extrovert. So I think a lot of this is how you organize your outreach and how you think about the outreach. And a lot of that is done in quiet spaces and quiet time. It helps to be able to go out and present, and I enjoy it. But Perry, after this, I'll probably go take a bath and read for a while because it's like a lot of energy output. So that's on the personal end. Commercial operations for pharma is really interesting because it delves into who are we actually who are we actually selling to? Who are we actually reaching out to? Who are those audiences? And if you are a big pharma now, there's an awful lot of audience difference from when I was at Roche. So I think I mean, big pharma, I think this is fairly well known. A lot of the drugs that are approved now are made through external collaborations, right? So pharma is not doing a lot of its own, particularly around biologics. Small molecules a little bit different, but let's keep it on biologics because that's my area. Um, they're seeking constant innovation externally, either through acquisition, in-house licensing. So that changes that whole commercial role. And it is at Phylloceuticals, we're well aware that pharma's looking for ideas and new drugs and different ways of doing things. So I think that's really great opportunity. I like the way it's changed the landscape. Um, that's the biggest change that I see since my day at Roche in the 80s.
Yeah, that's, I hear that from others as well. It really has, gotten more complex, I guess, I love your focus on, who your audience is. Isn't that always the most important thing? Yeah. Uh, it seems to me, from where I sit, that you have this career path that seems ideal for the role you're currently in. We're gonna talk a little bit about that, but I wanna talk about the CEO role, in a company like Phylloceuticals and how your career path, helped you. What did you get? What did you gather along the way that you rely on now in your role as a CEO?
Yeah, so when I had McDay and at CG Life, we had a lot of clients who were every stage of biotech. They could be, pre-seed, raising money all the way through, full scale. And what I noticed there is that many of those organizations, particularly in the early days, are run by scientists who have come up through the lab. And, I call myself a scientist as well, but there is a different perspective when you are coming up through that route. And I think that's the basis of your question because I've been in rooms and I've coached a lot of CEOs, scientists who want to wow the audience with the science, and they can easily lose the room because most of the people we're talking to don't connect on that level. They're not going to understand the deep depths. So I think the biggest thing is I guess that creative side, that PR, that marketing, always having part of my brain thinking about who am I actually talking to? Um, and building teams. I mean, I am enjoying, we have such an incredible team, and these days teams are remote. So some of us have never met, but I've been working with them now for a year and a half, and I feel like the culture would be echoed by the team. We are a really tight team and enjoy spending time with each other. And that happens with purpose. It's spending a little bit of time listening and feeding and feeling the room even virtually. I feel like it can be felt. So, that's a confidence that comes from having done this, a couple of times before. And then the other piece is just the actual organization of our outreach. Because this is, as I said before, alluded to, sales, market access, marketing all have something to do with getting out there in the world and talking to people. But it's also the behind the scenes organizing follow up. I mean, that to me, when I talk to people in any of these careers, it is all about organizing your lead production, your market access, whatever in our case, we're still raising money. So there's an investor CRM, there's a market access CRM. We're tracking using technology behind the scenes. And that's really important to us is choosing well who we are talking to on the back end, as well as the obvious, you know, do we have people who can go out and present and talk to people? So yeah, I think I said to somebody recently, it is the perfect storm for me of all of the things I've loved to do coming together. And we haven't even talked about the clean profile, all of the
Yeah.
actual pieces of philo, which we'll get into, I'm sure.
Yeah. Fantastic. Yeah, it does seem ideal. It's like everything you love and everything you've done is all culminating in one role. Yeah.
Really
Very
is.
exciting. So arguably, every new drug therapy is an innovation. And innovation's thrown about this industry. Everybody wants to innovate. Nobody wants to be first. You've got this regulatory environment that is pretty challenging. What are your thoughts on innovation these days, and just in general? Like, what is going on in the pharmaceutical industry, and how is innovation taking place?
Well, I think if you looked at, some of the recent statistics and approvals by FDA, I mean, top 20 biopharma companies, most of their innovation, a great majority of it is coming externally, right? Which I love. Um, Currently, the environment is, from a fostering innovation at its very early stages is more difficult, right? Fundraising is tough for pre-seed companies, but I think there's no question that pharma itself is looking for innovation externally, and they're acquiring or they're in licensing or and I don't think that will change. You know, I built or my piece of my career was in traveling all around the world to these manufacturing facilities when we were building, you know, just gigantic stainless steel infrastructures for in-house manufacturing. I mean, that everything was happening internally, and that is absolutely no longer the case. And it's hard to imagine a time when innovation will, be captured back inside big pharma. Um, so what I'm looking for is, and I'm hearing this a lot, that there is a recognition that some of the funding for this innovation, external innovation with small biotechs, um, is hard to come by right now. But I'm also seeing, and we are, you could put a lot of labels on us, but in some form or fashion, we are still a startup looking to raise funds. The money is there. So I feel like the money is just being held on to right now. And we're certainly doing our best to try to set some of that loose, but that's absolutely critical for that early stage innovation that has nothing to do with a particular molecule, but has something to do with different mechanisms perhaps, or things that people are studying that they don't know where things are going to head. Um, but that base research is critical, and a little fearful for that currently, but I think the tide will turn, and we'll start seeing more of that.
There certainly is uncertainty in the global economy, and, but I think, we're getting some good economic numbers, lately, and I think business always, rises, and they figure out how to overcome obstacles, and everything turns out okay,
And a
so
good idea, I mean, a good idea may not hit at the right time. So I'm not saying there are not good ideas that haven't found their home, but I can certainly tell you that there's still a lot of appetite to hear our story, and even very recently client stories that are innovative new things happening. So the appetite's there. And yeah, like I said, it will balance out. I'm firmly in the camp of this will come back around. But I think the trend for pharma looking externally to companies like ours is there for a long time.
Your optimism is comforting. You speak truths, so I always like to listen. It's
Well,
basically
thank you.
all right. I want to turn our sights to Phylloceuticals and talk. I'd like to hear you talk a little bit about maybe the five W's of Phylloceuticals: the who, what, where, when, and why. Can you tell us about Phylloceuticals?
Sure, I it's one of my favorite things to talk about.
Oh, Bent.
Yeah. So we were incorporated in August of 2024, but we've been together since the beginning of 2024. And this is a technology whereby we express proteins inside plant cells. I say the simplest of plants because it is. It's one of the simplest plants known to man, which is its own really interesting story, right? We've always had healing happening through plants for millennium. Um, but the idea that I built facilities where we would spend on the proposal that we would put out as Foster Wheeler, we would have viral deactivation steps at $6 million, big stainless steel, right? And we would regularly, because we use animal cells today, mammalian cell culture is what they call it. The the cells can't grow without additives. So we feed them a lot of growth hormones, a lot of other additives. And like I said, Perry, I did this regularly for a long time and never questioned it. And then I come across this technology whereby plants are their own perfect bioreactor. We can do exactly the same thing inside a plant cell with no additives, with no viral deactivation step. There are no viruses harmful to human inside plant cells. So I find the whole thing just amazing. And people say, well, why hasn't pharma been doing it that way then? And the reason, if you've been in this business or even read the papers long enough around pharma, they've been doing it the same way for a very long time. And for a very long time, they were making a lot of money doing it. So why would you ever change? In addition, the regulatory path, which I love that we have such a stringent regulatory path that keeps our medicine safe. So, and I worked very closely with that. I took FDA through Roche when I was 22 years old. So there's nothing negative there, but there's just a better way to do this. So then it becomes a question of how do you break through, right? How do you break through something that's been done this way for so long? And what I say to my team, what I say to, all of our contacts is we find areas that we can just show that this works, and we find those spots and we make products and we get data. And that's what we're doing now. We made our first PDL1 inhibitor in April, 12 weeks after we had a bare lab floor. We made product, Perry. And even I was astonished that we could get to that point, knowing that the drug development for mammalian cell is minimum months and very often years. And here we are in 12 weeks and we have micrograms, and we have micrograms of a product that is a blockbuster in its original form on the market today. So it is super exciting. We're getting a lot of really positive uptake around this clean profile. We're all shopping at Whole Foods and, making sure we're taking the right vitamins and eating and asking, where does this food come from? Is it local? Is it organic? But we've never asked a question about our medicine. And that's my marketing challenge, right? That's the cool piece of this. How do we bring our patients along the path of giving them enough information to say to their pediatricians, where does this medicine come from? Where's it sourced? That's my goal.
Another courageous move on your part to challenge the status quo. It started long ago, but the pattern continues.
Oh, that's so funny. I never made that connection until this moment.
What, so what does this look like? Can you describe this process? We have plants operating as bioreactors. What does that look like?
Yeah, so this is a duckweed, and it is a very simple prolific plant. And
Wait a minute, hold it. A duckweed.
yes,
So
it, it is
these
that.
exist. These exist out my window.
Exactly, exactly. I mean, we're gonna do it in a little more sterile environment, but the idea that we basically tell the plant what we want it to make, and it expresses just like we tell mammalian cells, those cells, Chinese hamster ovary cells, we tell them what to make. And then you've got to purify that. So our advantage is in the upstream part of these processes where we are expressing the protein, and then the downstream is really similar to today's mammalian cell purification process. But this is done hydroponically, so there's no dirt, there's no, picture a very clean robotic system where the plants are grown. Each plant, here's the cool thing, Perry, each plant, because it's its own bioreactor, think about this. We co-develop a product with a partner, say, and we show that we can do it, and we make the drug product that they're requesting. And then they say, okay, let's go to market. The scale up that you had to do, that I used to have to do in mammalian, meant that you had to spend an awful lot of time and money figuring out how big your bioreactor, it was a lot. There's a whole industry built on scale up. Here, you just grow more plants because each plant is inherently does what you already had it do at the microgram level. So scale up is 9 year eliminated. And that is, if you can picture a big clinical facility, it's trays of plants moving with air, light, a couple organic salts, and water. That's it. No fetal bovine serum, no, you know, no viral deactivation steps necessary. It's really incredible. But we're picking our spots. We're not looking to change the world overnight. It's business. The businesswoman in me says the way to do this is, yes, have some conversations with big pharma, but there are a lot of areas where today's mammalian cell can't produce, for various technical reasons, drugs that we would like to produce. Novel drugs, radioligands are a big one right now. Bispecifics. So Pfizer just made a huge acquisition in the bispecific space in PDL1, where you have to make two things connect in the same cell. That's not easy to do. It's easier to do in plants. So we're picking our areas. Um, I like to say when I'm on the tennis court and I have a big match, I'm looking for the weaknesses. I'm looking. So if I see their backhand, I'm going to hit a lot of balls to that side of the court. It doesn't mean I'm not going to hit down the middle. Doesn't mean I'm not going to hit to their forehand. In the same way, right now, we're looking for those openings, those weaknesses where a mammalian cell doesn't work, where there's a supply chain issue. And right now, Perry, because of this onshoring drive, we anticipate a lot of supply chain issues because even big pharma is pulling or discussing strategies on how to pull manufacturing here. That's really good for us because we can get them up and running. As I said, 12, 16, we're talking weeks, not months and years. And the facilities I used to build, the timelines were 3 years, to build a new facility. That is just simply, that's going to be old news pretty quickly as we start to put these plant facilities up easily in multiple areas. Um, so it speaks to hard to access. There are areas of this country where there's trouble and was trouble during the pandemic getting biologics that were needed. With facilities like this, they're just easier to get up and running in smaller spaces. Uh, so that access piece is something I'm exploring too. Uh, and the cost. 1/10 the cost per gram. So let's just pick Keytruda right now, $40,000 for an infusion, depending on, how often you have to have them. It can be as little as 23,000. Now that's market price, but the cost on the market to buy micrograms of Keytruda, $489 for 100 micrograms. If you play that out to a gram, we're talking tens and tens of thousands of dollars to buy 1 gram. So if we can make it, and we've shown already that we can make it at 1/10 the cost per gram, that alone is disruptive.
Yeah. Yeah. Truly incredible. I think you said it's incredible, and I agree. That's it. That is just astounding. So, there's so many benefits of this. You talked about the downstream. So you said how critical the upstream is, but the downstream is impacted by this, and it's simplified as well, is it not?
Well, it is only in the viral deactivation steps are not
Yeah.
necessary, so that's a big cost savings, but
Yeah.
basically, I like to say that it's sort of the same process. Well, it's very much the same process because, I think of downstream as going into fill finish and, where this ends up. So the idea that we would either be partnering with CMOs who could do that downstream, or depending on the path that we end up taking, we have in our plans, commercial facility that would take care of the whole thing. But the switchability again of make this and then make that. I remember being in the industry, long enough to know there were a lot of theories about, well, we can switch product pretty easily at these big stand. Well, it's just not as easy as everybody thinks.
Yeah.
And here, you're just growing different. You're growing the same plant to make a new product. So switchability in these big facilities becomes faster. Great for pandemics. God forbid, we have to deal with that. But there's almost enough threads that I have to put the marketing hat on too and watch as we pursue these multiple paths. No question, it will get narrowed slightly depending on where the pickup happens. But right now, we're not limiting ourselves. We don't think we have to.
Yeah. So, how do you describe are you a technology platform, a biosimilar company, a, CDMO CRDMO? How d what and what do you want to become?
Yeah. It I don't want to be known as just one of those, right? Because we're not coming to market with one product. So we will be all of those at various times, I think, in our future. We can and will make biosimilars. We just made one. So but I would rather be known as I'm gonna say a dynamic partner where in many cases I could see co-developing with big pharma, say, a product that they're interested in, but we are also making our own products. So we have a library of biosimilars. We're making our second one now. Again, we've only been incorporated since August, so we're moving fast. By the end of this year, I hope to have a library of 4 to 5 to show what I alluded to before, a sample of a novel product that is difficult to make in mammalian cell, a sample of a supply chain where, it's just difficult to get something that we can clearly show the 1/10 the cost per gram. Um, Basically, our display window of the 4 or 5 things. And the way this works is, you know, whichever gets picked up on first, we're moving in that direction. Of course, that's what's going to happen. Um, yeah, there is a blockbuster play too here because, you know, we're in conversations already with big pharma. Is there a way to extend patent life using plants as the version? So we're exploring that. And, that could have blockbuster potential. But I don't count on any one thing. I think if you stay organized and we have an amazing team of 10 that have been working on this for, a year, I can see that the path will become clear, but it's kind of like what we talked about with career. You just stay open, right, Perry? And then talk to me in 6 months, and I think we may have chosen a path or two. But right now, I love that we're staying open to all of those possibilities. We could easily be a CMO for someone, right? But I like dynamic partner.
Susan, amazing. That's just amazing. I love that philosophy. So many paths and you're not fixed on any one of them. Just kind of just be open to all of those opportunities. I really love that strategy.
Well, thank you. Yeah, investors who you talk to often like you to focus. And I just have said, well, here's why we're not.
Yeah. Yeah, awesome stuff. Um, I look forward to hearing about the success of Phylloceuticals and you. This is going to be really amazing stuff. I want to stay very close to this. So I hope you'd let me know as you hit
I
one milestone.
absolutely.
Yeah.
You're on our list for the regular monthly update. We have some fun. We're good marketers, so we of course have a monthly newsletter.
Of course you do. Thank you. I want to wrap up with kind of you offering some advice. So you're sitting, maybe you have an auditorium of 400 people who are earlier on in their careers, and you want to give them some Susan Stipa advice. What would you tell them?
Yeah, I talk to a lot of STEM groups of middle schoolers here in the Philadelphia area, and I'm a big fan of go after a science degree because you you had a lot of passions, and I would get, if I'm one on one, I'm asking them, what do you love to do? Many of those things you can continue to do, but you need professors and teachers to learn science. Once you have that science background, the world is your oyster. And it doesn't mean, like me, I wasn't in it for very long as a pure scientist. You can do so many things if you have an understanding of how the world works. And I get a little pushback on that. Well, math and physics, I don't get it. I don't get it. And it's okay. I say you don't need to understand necessarily all the details of how this will equal that. Your biggest strength is in staying open. And if this isn't something that you can teach yourself, then, you know, pursue that and continue to do all the creative things that you love to do because that's going to make you a great employee or a great business owner or entrepreneur. Um, so I usually get them talking about what they love to do. Keep doing that, and don't think the two are so divided. I think one of the things I work really hard on is trying to convey that work and your life do not need to be separate. We can integrate those a lot more readily than maybe we could when I was young, where work was work and life was life. To me, life should be partially work, but life is life, and work should be a part of that. So I think that's the discussion I love to get going. Is don't be so scared that if you choose this, you are going to be known as a chemist for the rest of your life. Like that's just training that you couldn't get elsewhere. And then you incorporate that into the things you love, stay open, and your career path will not go in this, one probably not go in the direction you could even anticipate in 6th grade or 7th grade or in high school. And that's okay. And I think when they see people who have lived that and are really comfortable with that, it makes it a little easier to not feel like they have to pick a career path so young to know exactly what their job is going to look like. Just get the training. So yeah, that's my advice.
Very wise advice, and you're a great example of exactly what you're talking about. So super, super stuff. Um, prior to us meeting today, I did this intentionally. I wanted to see how many CEOs there were out there in the biopharma industry. Only 10% of CEOs are women,
Wow.
which startling. I wish it was more. I want it to be more. Women are going to college at higher numbers than men. They're finishing college in 4 years and at greater rates than men. What would you So this is instead of young people, what advice do you have for the industry? Like how can we do better at this? I feel like we're missing out on some talent that's hiding out in these biopharma companies.
Yeah, that's really interesting. A little shocking, because I know so many women who are so talented. I mean, I do think it still goes back to that middle stage of our careers where we may have stepped aside. I have 4 children. It was tough in that period of time to keep up. But I think there's also another piece here, and that is the financial piece of this business. The CFO kind of side of things, the spreadsheets that I think there is sort of a divide that happens that maybe more male in that middle career getting more women into the business side, and I mean the financial side of the business, and then allowing, that career path to continue. I mean, this is a sort of a pregnant thought, but I feel like that was a huge help for me. I had a mentor, a CFO, who really took me aside in one of my commercial roles and forced me to understand that side of the business. That's been a huge help because again, not something you can really just pick up on your own. Um, and I think the the so I do a lot of networking with other female CEOs and leaders in the Philadelphia area in particular because it's easy to get together. So I think we need to invite more men to those. I mean, I really think that I've had 3 amazing mentors, all men in my career that have changed my trajectory. And yet I feel like we get together and it's so worthwhile to support each other as women. But I feel like there's a way to cross that and not make it again, sort of going back to not siloing phylloceuticals, not siloing anything. Like bring us together. Let us talk to you about what this feels like to have been a mother of 4. Those kinds of conversations when you have them with men, they get it. It's not rocket science. There's not as big a divide. And, we're both in the media, Perry, but there's not as big a divide as I think we're led to believe. So I would just say, just put it out there that that's something you want to do. You want to run a company and your own personal path, and then just make friends across every aisle and get the context, get the finance. That's big. 'Cause I think that's where there may be a little more than we're aware of as a lack. Because you can't really run a company if you don't understand that piece. So yeah, I'm a big believer in breaking barriers down, not in siloing anything, as you can tell throughout this conversation. I feel like the same thing here. Um, Bringing women, the women's support does not have to just sit inside women's groups only. Um, so I don't know if that is the best answer, but it's certainly been what I've done and it's worked.
Awesome advice. It has worked. You are living proof that it works. So thank you very much for that. What a great conversation. So many awesome, valuable takeaways. Well, thank you, Susan, for being with the Trailblazers today.
Oh my goodness, Perry, it is always so nice to talk to you. We've known each other a long time, but to just give people an opportunity to just talk about themselves. I mean, can you just stop by every week?
My guest today has been Susan Stipa. She is the CEO of Phylloceuticals, a fascinating company that's using plants as bioreactors with so much positiveness coming out of that model, very innovative model. And keep an eye out for them. There, I think you're going to hear some big things about that. Susan, thank you again for being on the Trailblazers.
My pleasure, Perry. Have a great day.